have my energy back. I'm living life like I was before.
That is Haley, and you get to meet her. She is joining us this morning along with her doctor, Dr. Joshua Red. He is a chiropractic physician. You diagnose lots of different things, including low thyroid. What did you diagnose Haley with?
Yeah, one of the things that we deal with is autoimmune diseases, and she actually has an autoimmune disease attacking the intestinal tract, but also causes a lot of symptoms elsewhere, like low thyroid and things like that as well.
So what symptoms did you have when you called Dr. Red?
I was cramping like every day. I almost actually felt like I was pregnant. I'd have nausea when I would wake up, and bloating. It was so painful. Every day I'd lay on my couch with an ice pack or a heat pack and just kind of lay there. I had no energy to do anything.
And what did you think it was?
You know, I had gone to a doctor previous. I went to my gynecologist and thought maybe it was an ovary symptom because it was so low in my abdomen, and then went to a GI specialist and he thought that it was maybe IBS. But it was so frustrating because I felt like almost it was in my head, like maybe I could just pop out of it and it would just go away, because nobody really gave me a diagnosis of anything.
And do you hear that pretty often?
All the time. We see a lot of these doctors where they're just treating symptoms for these chronic conditions and nothing's being done to the mechanism that's actually causing it. And so they're so quick to, here's a pill for your symptom and that's it. And the mechanism gets totally overlooked and these patients still feel little to no improvement, and it's pretty frustrating.
So is this something you treat or do you manage? And what's the difference?
Well, treating is more like you can cure it and things like that. With these types of conditions, you can't cure. You can manage it. You can find the imbalances that are causing it to flare up and causing problems, but you're not going to be able to cure it. So what we do with our patients is we do a lot of extensive medical testing and analysis to figure out what's actually causing their condition, and we go in and try to get those imbalances function a lot better, and then we teach them the tools to keep them in check and keep them functioning a lot better as well, so they have a lot better quality of life. But that's kind of the big deal here, is that we want them to be kind of the expert in their own health. And so they're going to always have to manage it for the rest of their life, but we're giving them the tools to do that.
Haley, did you say finally some answers? Finally someone knows what I'm going through?
Yeah, it was so nice. You know, there was a point where I was so miserable. I couldn't do anything. My family life was just falling apart. My 9-year-old daughter came to me one day and said, "Mom, I want my fun mom back." And it was so frustrating and hard because I didn't know what else to do. And when I met Dr. Red, he gave me tools to fix that, and I have felt so much better, so much better. I'm back to working out. I'm back to my active lifestyle. I mean, there's still some things that I have to work on. You know, I have to be really careful about my diet and what I eat, but I feel so much better.
It's so true. When you don't feel good, it's hard to be the fun mom. It's hard to do all those different things. We put on the screen symptoms also of low thyroid, and you mentioned fatigue, weight gain, depression, anxiety, insomnia. Lots of people dealing with those and probably just thinking, it's what normal. I have, it's normal.
And a lot of these patients, there's a ton of women with low thyroid as well, but the problem here is that they go to the doctor will just run what's called a TSH marker, and that's it, and they'll prescribe them a thyroid hormone, and nobody figures out what in the world is actually causing low thyroid. So if you have a low thyroid, ask yourself, what's causing my specific low thyroid? Because you as a patient are totally different than the next, autoimmune patient or thyroid patient, things like that as well. So
should it be a combination of those symptoms? I mean, how do people know when they should go in and seek help?
It's so different because some patients will just have significant fatigue and that's it. Some patients might have fatigue with severe intestinal problems and headaches and depression, things like that as well, or brain fog or the clarity. They just can't quite think of things properly. And so, our process is very detailed, very extensive. We do a lot of extensive medical tests. We try to pinpoint exactly what's causing that person's specific thing, and then work to get those imbalances function a lot better as well. So.
And then you're a new person, right, Haley?
Yeah. I would say don't wait, because I waited for 2 years, and had I just gone in and even just had a sit-down chit-chat with him, I think that he probably could have figured things out so fast.
This is what women do, though. We put it to like the last back burner.
We try and take care of it ourselves.
We're like, we got it.
Go ahead.
I got it.
It's funny because they have the children like, oh, I'm just fatigued because I have my child, and they just feel worse and worse and worse. And then really they have a slew of other imbalances that you could work with that get them feeling a lot better and have a lot better quality of life. But they do put it off a lot. We see that a lot. I mean, after 10 years, we'll see patients that come in and they feel better than they have within a month, better than they have in 10 years.
Finally get some answers. All right, this is the person to talk to. We'll put all his information on our website, but he is at the RedRiver Health and Wellness Center in West Jordan. Again, this is Dr. Red. He's a chiropractic physician. And also, there's the website, but we can link you from ours at abc4.com and click on Good good things, Utah. Locations, I mentioned West Jordan, but also St. George.
Yeah, we also have a St. George location as well. And you can go into our website for a free brochure, look at a lot of different patient testimonials and all that stuff as well. So
Haley will be there right on the website. Thanks for joining us.
Thanks for having us.
Coming up next, everybody, we are headed into the kitchen. We're not eating this time. We are drinking some fun end of summer recipes for you next.